endocrinologist and a nephrologist. He has several books, and the obesity code and the longevity and fasting. And he focuses on diabetes and fasting and insulin resistance. Now, I think in the weight loss community, we know all these terms. I think some of us even have the condition. I myself have never had a high blood sugar, but I think I have had obesity. So I think, and I wasn't able to lose weight from 2011, 2010. It just wasn't what I was doing in the past years, just wasn't working for me anymore. So I think with a hormonal disorder, I think with a metabolic screw up in my body for so many years, and I had just messed everything up, compounded by eating a lot of processed foods, a lot of carbohydrates, a lot of unhealthy foods. I made myself insulin resistant. Whatever the case may be, I became obese with a BMI of 37. I became had sleep apnea. I had swollen legs. I had high cholesterol. My self-esteem was broken. I felt horrible, and I really needed to repair myself. So I sort of climbed out of that hole, and I've been working on my body and my health since 2012, since I had my weight loss surgery. So every year I reinvent myself, I change it up, I do something different, I learn, I explore, I change my exercise up, I change my diet up. I do something to improve myself, whether it be emotionally, whether it be physically, whether it be to try to improve my life skills. So I really try to focus in on dial in 2018, learn how to fast. I've been in maintenance since a year out of surgery. You can go back on my videos, I've done every body hack I could think of. I try to keep myself in maintenance, and it's been really, really hard. No matter what I do, my body gets used to it. It tries to take me back to the high weight, my set point. I'm trying to lower my set point. I'm trying to get on my highest, I was 215 pounds. At my lowest, I was 147. I couldn't hold it there. I'd like to get back to 140. Unfortunately, my body's fighting me all the way. So I have to set my body, my set point in small increments. So this year I'm working on maintaining my maintenance at a certain level, to lose 5 pounds gradually, to lower my set point, to keep it there, and then the next season work on another 5 pounds. I'm doing it 5 pounds, 5 pounds, 5 pounds. So I'm sitting at about 160. I fast every day of either intermittent fasting or one meal a day. Some days I don't. I switch it up. So I'd like to share with you Dr. Jason Fung. I'm going to put a card in his channel.
Or you turn it into fat, which is de novo lipogenesis. You store body fat. So you store sugar and fat, and as you don't eat, as you fast, insulin levels drop, and again, that's the signal to start pulling back out that food energy. But glycogen, you break down the glycogen, and if you don't have that, then you'll break down your fat cells, which is lipolysis. So insulin, for example, turns on lipolysis, you burn fat, and glycogenolysis, which is breakdown of glycogen. So this is a natural cycle, and that's a
So in the weight loss community, that's our objective, right? I mean, we have plenty of body fat. We're not going to starve. So if you're under a lot of medications, if you're type 1 diabetes, then you have to be careful, you know. But if you have enough stored fat, you're not going to starve. Your brain may think you're starving, right? This is what we have to fight. We have to fight the mental food beast, right? Some of us are used to, before we went on our surgery, we're used to eating grazing, right? That big buzzword, we love to graze, don't we? Some people say, well, I'm not a grazer. I'm a big quantity eater. I'm a big quantity eater, they say. Okay, well, you're a big quantity eater. But the point is that how many times do we tell stories to ourselves and we say, oh, I ate a healthy diet. Oh, I ate healthy. Oh, I exercised. But you're still obese. You didn't have weight loss surgery because you were skinny. You didn't have weight loss surgery because you didn't have any fat cells. Your first year, your first 6 months, your surgery is going to do its job. Whatever kind of surgery you had. Like me, I had a restricted procedure, a lap-in. Didn't offer no metabolic reset. I think I had maybe 3 months of it. That's about it. And then I was on my own. So if you've had gastric bypass, now you probably might have a year of metabolic, with your surgery, weight loss, that is going to do its job without having to do any of this. But once your surgery, your medical weight loss ends, your body gets used to what you're doing, you're going to have to find another way. Unless you've already unless you've succeeded the first year and lost all your weight, you got to a normal BMI, whatever it is. I never got to stay at my normal BMI. I couldn't hold it there. So I had to fight because my body likes to raise my set point. Even though I've been low carb, even though I've been exercising, even though I've been restricting my calories, even though I don't eat rice, even though I don't eat bread, even though I don't eat potatoes. Am I absolutely perfect 100% of the time? No. But at least I found this tool that I can use. To what? To fight the food beast. Because I am stronger than the food. And I believe I can and I will. That's my mantra. So, Dr. Jason Fung, he speaks the truth.
The reason you don't die in your sleep every single night is because you have stored energy, and you don't need to keep pumping it in your body to do that. So insulin actually does two things. So not only does it put the glucose into the cell, which is the normal function that we think about, but it also turns on this kind of storage. So it turns on de novo lipogenesis. So you're going to store energy as your insulin goes up. Now, if you say you're insulin resistant, then you should be resistant to both of those. And for sure, number one works because the glucose isn't going into the cell. You see it into the blood. You see it in the blood. But it's not true for the de novo lipogenesis. And this is the sort of lock and key mechanism that we talk about. So insulin is like a key. It turns the lock, which is the insulin.
So the second half of this podcast, and I'm going to link a card, he does reference bariatric surgery. So I don't know exactly where it is, but it is in here.
If you give them a lot of sugar,
He talks
a lot of
about
glucose,
fatty
you can
liver.
actually produce fatty liver. And what's fascinating,
He talks about the pancreas, when the pancreas and the beta cells. You'll learn a lot about science and how the fasting really affects the body.
why we ever think it would work, but this is what the body does. It's similar to antibiotic resistance. So if you didn't know any better, if you had an antibiotic and the bacteria become resistant, you'd say, you know what, I'm going to use a double dose of this antibiotic.
So he goes into a lot of things that's easy to understand. I don't think that this video is hard to understand.
Much higher levels of consumption of fructose in the kind of modern societies compared to, say, China would.
But he does make reference to bariatric surgery. And actually what's interesting is
Cell dysfunction, if you don't treat it, almost always follows the insulin resistance, and you almost never get the beta cell dysfunction for any.
he talks about the lap band, which everybody has taken out. I'm probably one of the last of the lap banders that still have one in. Because I can't get a revision. I have no insurance and my medical insurance anyway. I would have to gain all my weight back to get a revision. So I'll just keep this device and work hard. But he does talk about bariatric surgery. He talks about the lap band and how it will reverse type 2 diabetes.
Been able to stop it because we've been going at it the wrong way. So this is the whole thing. If you have the paradigm wrong, if your understanding is wrong, then everything follows is incorrect. So here's a normal situation. You have blood glucose on the outside and you have glucose on the inside of the cell. The internal starvation paradigm, which is a...
So he goes on and about starvation. It's amazing how people think of fasting and how some medical practitioners think fasting is a bad thing. They have old dogma. They really need to read and research because so much in science has changed. And there's autophagy. I'll link that card. Professor, there is a new buzzword, and it's called autophagy. And it's the 2016 Nobel Prize winner, Yoshihiro Asumi. He's from Japan. He won the Nobel Peace Prize in 2016 for cell eating, rapamycin, and how the cells eat itself with fasting and how you can really do your body good and some changing some cancer cells and all that kind of stuff. And along with, you might want to check out Dr. Walter Longo. He's with the fasting mimicking diet. He studied the 12 years of the blue zones, and he has a website. So anyway, I'm going to wrap this up here.
Cohort study, everybody says, oh, there's problems with the cohort study, but the BADT study, the advanced study, the origin study, the TICO study, the SAVOR study, they all show the same thing. Lowering the blood glucose with medications doesn't really work. The advanced study.
And then he talks about diabetes medications where actually they don't work and they rot your body from the inside out.
Percent absolute risk reduction, which is absolutely it's a huge number. And the second thing is to burn it off, right? If you have too much sugar, either don't put it in or burn it off. And that's what intermittent fasting does. And again, you can look at a more recent drug, which is a sort of drug corollary to intermittent fasting, if you will. And that's something called empagliflozin, which is a new class of medications called the SGLT2. And essentially what you're doing is you're making your body urinate out all that sugar. So yes, there are side effects of that. You get urine infection, you get yeast infections, you get this ketoacidosis. Nevertheless, if you think about it, what you're doing is incredibly powerful because you're emptying that sugar bowl. So what happens to cardiovascular events in this case? Well, this is the events, which is cardiovascular events. And again, you get a...
So anyway, I'm going to wrap this up. I hope you find it interesting. I do. And I'm always learning and trying to advance my learning as far as obesity control, trying to make myself better, trying to be a better me. Thank you for tuning in. Give me a like, give me a comment, subscribe, and see you in the next video.